Hi, I'm Crystal Clear. In today's class, we will be discussing prostate, how it functions, early signs you should never ignore. And don't forget to follow me for more educational content. Please share this video to save someone out there. Now let's start. Hello everyone, and welcome. Today, I want us to have an important conversation about something many men don't always feel comfortable talking about, but really should. And that topic is prostate health. Let me start by asking you a simple question. For many people, the first thing they think about is prostate cancer. But here's something I want you to understand right from the beginning. Not every prostate problem is cancer, and an enlarged prostate does not automatically become cancer. There are several conditions that can affect the prostate, and understanding the differences can help men know when to seek medical attention. So, let's start with the basics. First, what exactly is the prostate? The prostate is a small gland that is part of the male reproductive system. It is located just below the bladder and surrounds part of the urethra, the tube that carries urine out of the body. The prostate also produces fluid that becomes part of semen and helps support sperm. As men get older, the prostate often becomes larger. Because the prostate surrounds part of the urethra, enlargement can sometimes interfere with the normal flow of urine. So you might be wondering, if my prostate becomes enlarged, does that mean I have cancer? The answer is no. An enlarged prostate does not automatically mean prostate cancer. One of the most common prostate conditions is called benign prostatic hyperplasia, or BPH. Let's break that name down. Benign means it is not cancer. Prostatic refers to the prostate, and hyperplasia refers to an increase in the number of cells that results in enlargement. So BPH may notice that it takes longer to start urinating. He may feel that his bladder hasn't completely emptied. He may need to urinate more frequently. And he may wake up several times during the night to use the bathroom. But remember this very important point. BPH does not cause prostate cancer. However, a man can have BPH and prostate cancer at the same time. Another condition that can affect the prostate is called prostatitis. Prostatitis means inflammation of the prostate. Some forms can be associated with infection, while other forms have different causes. A man with prostatitis may experience urinary problems, pelvic discomfort, or pain. So let's make this simple. We have BPH, which is a non-cancerous enlargement. We have prostatitis, which means inflammation of the prostate. And then we have prostate cancer, which involves abnormal cells growing uncontrollably. These are different conditions. That's why proper medical evaluation is important when symptoms appear. Now let's talk about prostate cancer. Normally, cells in our bodies grow and divide in a controlled way, but sometimes changes occur in a cell's genetic material. When abnormal cells continue multiplying uncontrollably, they can form a cancerous growth. Some prostate cancers grow very slowly and may never cause serious problems. But other prostate cancers can be more aggressive. They may grow faster and can eventually spread beyond the prostate to other parts of the body. And here's something very important. Early prostate cancer may not cause noticeable symptoms. A man can feel completely healthy and still have prostate cancer. So, what warning signs should men pay attention to? A man may have difficulty starting urination. He may notice that his urine stream has become weaker or stops and starts. Hindras and starts. He may need to urinate more frequently, especially at nation. Some men may notice blood in their urine difficulties. And persistent pain in the back, hips, or pelvis should also be medically evaluated. But please remember, these symptoms do not automatically mean prostate cancer. They can also occur with BPH, prostatitis, urinary infections, or other conditions. So don't diagnose yourself. Sometimes a man notices changes in his urination but tells himself,
"It's probably nothing." Or perhaps he says, "I'm just getting older."
But here's the problem with ignoring symptoms. You don't know what's causing them until you've been properly evaluated. The cause could be BPH. It could be prostatitis, it could be a urinary infection, or it could be another condition that needs medical attention. So don't try to diagnose yourself. Don't ignore persistent symptoms. Get evaluated. Getting checked doesn't mean you have cancer. It means you're taking your health seriously. What can I do to protect my prostate? There is no guaranteed way to prevent prostate cancer. However, healthy habits can support your overall health. Stay physically active, eat a balanced diet, maintain a healthy weight, avoid tobacco, and know your family history. If your father or brother had prostate cancer, your risk may be higher. Certain inherited genetic changes can also increase prostate cancer risk. That's why it's important to know your family's medical history. Ask questions, talk with your relatives when appropriate, and make sure your healthcare provider knows if prostate cancer has affected appropriate scrambling with you. Now let's talk about a test that many men have heard about, the PSA test. PSA stands for prostate-specific antigen. It's a blood test that measures the amount of PSA in your blood. But here's something extremely important. An elevated PSA does not automatically mean prostate cancer. So if your PSA is elevated, don't panic. Depending on a man's age, symptoms, risk factors, and individual circumstances, a healthcare professional may discuss PSA testing and sometimes a digital rectal examination, also called a DRE.
So it's not automatic?
No. If there is concern about prostate cancer, additional evaluation may be recommended.
Just repeat PSA ting ojing.
What if it's high? Now, why does early detection matter? Imagine that prostate cancer is discovered while it is still confined to the prostate. That's very different from discovering cancer after it has spread to other parts of the body. The stage with lower risk prostate cancer may be candidates for active surveillance. That means the cancer is monitored carefully rather than immediately treated. Other men may require treatment. Depending on the individual situation, treatment can include surgery, radiation therapy, hormone therapy, chemotherapy, targeted therapy, or other approaches. The right treatment depends on the type, stage, and characteristics of the cancer. That's why proper evaluation matters. Now I want to address something very important. Some men feel embarrassed talking about urinary problems, sexual difficulties, or prostate symptoms. But there is absolutely no shame in taking care of your health. There is absolutely to become severe before asking for help. Sometimes the cause is become severe before asked condition. So if you remember only one thing from today's conversation, let it be this. Don't ignore your prostate health. An enlarged prostate does not automatically mean cancer, and prostate symptoms do not automatically mean cancer, but persistent changes should never simply be ignored. Pay attention to changes in your health. Bye.